let's talk about opioids. We know opioid is a very broad term for anything that works on opiate receptors in the CNS, but opioid use, or I should say misuse and abuse, is on rise every year for last 10 plus years now. So I will discuss this in these sections now. But first, let's start from basics. Let's understand the opioids metabolism. So we know that opium produces the codeine, which gets translated or converted into many forms. One of them is morphine. And morphine has many metabolites. One of the minor pathway is to hydromorphone, but opium can also cause the formation of morphine. So stay mindful of that. Now, focusing on codeine here, it has many metabolites, as I said. One of them is norcodeine, and one of the minor pathway here is to hydrocodone. And hydrocodone can also get converted into hydromorphone. So very important to know these pathways, just basic overview, because I will tell you in few minutes why this is important. But heroin, which is one of the commonly used drug form, gets converted into 6-MAM, MAM, which is monoacetyl morphine, which in turn gets converted into morphine. You see how pathways are going to morphine. That's why have made that white circle around that. Heroin goes through that. Opium, codeine goes through that. But there are other opioids which does not go through this pathway. And one of them is oxycodone, which gets converted into oxymorphone and noroxycodone. And then we have methadone, one of the commonly prescribed medication to use opioid use disorder. It gets converted into EDDP. We'll talk about all that in few minutes. But this was a very basic overview of the opioid pathway metabolism. Now, let's talk about the opioid immunoassay. How is this relevant to what I just mentioned with that confusing diagram? Let's talk about it. So, the first thing is most of the conventional immunoassays use the morphine as a single calibrator drug to set the threshold. Let me show you that diagram again. So morphine is one of the important calibrator. And what that means is the cross reactivity of antibodies between morphine and oxycodone, hydrocodone, hydromorphone, and oxymorphone is low. Let me show you the diagram again. So these are the four one that we are talking about. So there is a low risk of that. That results in false negative result risk. So, you're using morphine as a main calibrator, but the risk of cross reactivity between the antibodies for morphine and all these four is low. So be mindful of false negative with these four. Let me show you those four again. But you can actually download this PDF below and look at that as well. Let me go back to the last slide. And what that translates into is you need advanced immunoassays or those confirmatory LCMS or MS to make sure a person is on oxycodone and those less cross reactivity options that we talked about. Now, moving on to the other ones like fentanyl, methadone, and buprenorphine, they are not similar to the chemical structure of morphine. So, they require specific immunoassays. So what comes down to is that morphine is so important, right? If the medicine or drug is not similar to morphine, you need specific immunoassays for that. But If there is less risk of cross reactivity of antibodies between morphine and these four drugs on top, then the risk of false negative is there and you need the confirmatory test. So stay mindful of these factors here.